I'm the KAP conference organizer, and at this point I'll be presenting my study on accessibility of cardiac services in Kenya. So this was a project implemented and funded by Philips Foundation. We implemented the project in 3 counties, Garissa, Embu and Kiambu, where we were having STEMI improvement by giving ECGs to these 3 counties and also training healthcare workers on STEMI management for 2 years. So acknowledgement. I'd like to acknowledge Philips Foundation and Heart Attack Concern Kenya. So background, Kenya is experiencing a steep rise in cardiovascular diseases with 25% of hospital admissions and 13% of death. And about half of the patients suffering from cardiac issues have heart attack and die before arrival to the hospital. So diagnosis and management is usually time sensitive, and with a recommended revascularization therapy of 120 minutes. We therefore estimated the travel time to the nearest health facility, where we have a cath lab and an interventional cardiologist. So for methodology, we took facilities with a cath lab and cardiologist from the Kenya Master Health Facility and different data sources. The facilities were combined with a spatial database of road networks, elevation and land use, and travel barriers within a cost-friction algorithm, and travel time from any location in Kenya to the nearest facility. So 3 travel scenarios were considered. You either go to hospital using a bicycle, or you go to hospital using a motorized and also by walking. So mean travel time that we estimated for this project was 120 minutes, which is what is recommended within 2 hours before you present to a hospital and to any cath lab facilities. And we summarize at the county level and use the world mapping. Further, we performed an optimization analysis by including 1 facility that we've actually trained the doctors away from the 3, and we would like to see how that accessibility would look like. So on your screen is the cath lab facilities, and as you can see, they're actually in Nairobi, in the coast, and in Nyanza province. So this is Nairobi, where we have about 5 facilities that have cath lab and interventional cardiologist. And then in Mombasa, at the coastline, we have 2 facilities. And Kisumu and Eldoret, we have about 3 facilities. And this data is based on data that we got in 2022. So I'm sure that there has been an improvement since then. So as you can see from this map, the people who are closer to the facilities actually were able to get to the hospital within 30 minutes. Those who were further away, this is green, and the yellow you can see it's actually within 31 to 60 minutes. And those who are further away, the red borderline, were actually about 11 counties which were away, and that is like 91 to 120 minutes. And this was 46.38% were within 2 hours of cath lab facilities in Kenya. So the next map you can see is accessibility to Kenya facilities and what can be done to increase geographic access to revascularization therapy. We thought that it would be well if you improve and upgrade facilities in the northern region in Kenya. As you can see, we don't have any facilities that have actually a cath lab and an interventional cardiologist. Then what would that look like in terms of STEMI preparedness? And we included 2 other facilities at the northern Kenya. And you can see this will reduce, when you do this, it will reduce the mortality rate and adverse cardiac outcomes, and 49.3% are within 2 hours of cath lab facilities in Kenya, and compared to 46.38 without upgrading any facilities in the northern region. And only 8 counties cannot access any cath lab facilities within 2 hours, and before there were 11. So these are the counties within 2 hours of revascularization therapy. And as you can see, if like most of the patients who are in the northern region could not really have any access because most of our facilities are centered within urban areas, within the coast, Nairobi and Nyanza, and 84% of these counties could only access revascularization therapy within 2 hours of onset of STEMI symptoms. So when you improve the two hospitals at the northern region, you can see that the map has really changed. That means you have more accessibility of STEMI services in most parts of Kenya. Still, we have a lot to do in terms of STEMI preparedness in our northern parts of Kenya, but this is something that maybe can be considered in our policies and also at KP when we bring doctors together. So about 19% of the counties cannot access the cath lab facilities within 2 hours, and 81% of the counties could access revascularization therapy within 2 hours of onset STEMI symptoms. So population, so we went ahead to look at the population, and we got our population from the 2019 census, population census. And as you can see from the map, from the emission before improving any services within the northern region, about 46.38% can access the cath lab facilities, and 13% of the population could not access revascularization therapy within 2 hours of onset of symptoms suggestive of STEMI. So as you can see, these proportions, 79 to 100, these are the people who are actually very near the cath lab facilities and intervention cardiologists, so that at least they can be helped. When you improve the facilities, you can see that the population access increases, and you have 13% of the population could not access, and you can see that we actually have majority of the population being able to be attended to when they go and seek for cardiology and STEMI services. So in conclusion, majority of the counties could not access the facilities within recommended 2 hours, and with the changes in epidemiology of disease to an increased NCDs, there is need to improve investment in cardiac care within existing hospital in spatial access. Thank you.